Hello, my name is Lauren.
My name's Min.
We're pharmacy students working with the Transplant team, and today we're here to help you fill your Pillbox.
Now that you've had a transplant, you can expect to be on medication for as long as you have the new organ, and it's important that you don't miss any doses. Your Pillbox will help you stay on top of your medication to help prevent rejection of your organ.
Your current medications may also change during these next few months. Depending on your lab values, how your body handles the medications in transplant, your Pillbox will help keep any changes made to your medications organized.
It's possible that the team may help you fill your Pillbox up until the day of your first visit to the Transitional Care Clinic, or TCC, but we want to make sure you're able to successfully fill your Pillbox at home.
The key to successfully organizing your Pillbox will be the medication folder that you'll receive before discharge. The folder should list all of the medications you'll be discharged with, including your new anti-rejection and infection prevention medications.
The folder will include both brand and generic name of the medication, strength, how often to take it, what times to take it, and may even include what the medication looks like. But please keep in mind that these medications may look different depending on the manufacturer and the form of the medication.
The folder should be an accurate guide to filling the Pillbox. Earlier we mentioned that it's possible your doses and schedule of your medications may change depending on your labs. And when those get updated, so should your folder. Sometimes the transplant team may be able to update the folder, but if we can't, then don't forget to do it at home and in pencil.
While the folder will include every medication you'll be taking, including any blood pressure and diabetic medications, we will focus mainly on the anti-rejection and infection prevention medications in this video, so remember to fill those medications as well.
Now it's time to fill your Pillbox. Yours might look like this, or it could look a little different. Notice that it has a column for every day of the week and 4 spaces every day for morning, lunch or afternoon, evening or dinner, and bedtime.
Now that you have your Pillbox, you want to grab your other supplies, including your medication folder and all of your medication bottles. For your workspace, you want to sit in a well-lit area at a table with plenty of space for all of your supplies. For the setup, we recommend placing the Pillbox right in front of you with a folder above it, and all your medication bottles to either side of the Pillbox and folder. To make sure that you don't miss any medications that should be filled, we recommend lining up the medication bottles in the order that they show up in the folder, and also going down the list in that order. We also recommend moving the bottle to the other side of the folder when you're done to help you stay organized.
First, you want to grab your first medication on the list. If you have multiple strengths of the same medication, grab all of the bottles. Once you have your first medication, find it in your folder. Then you want to check how often you're supposed to take it and at what times. If you have multiple strengths and or taking medications multiple times a day, you also want to double check what time you're supposed to take what dose.
In our example, the first medication we'll be filling is our tacrolimus or Prograf. Some patients will be on this once a day and some might be on it twice a day. The once-a-day form is called Envarsus, which comes in different strengths compared to the twice-a-day form. In this video, we'll be using the twice-a-day form of tacrolimus, but we'll still give instructions on how to set up your Pillbox in case you're on Envarsus. In our folder, the dose of tacrolimus says 8 mg twice daily, so we'll want to grab our 5 mg bottle and our 1 mg bottle. Our folder says we're taking it in the morning and in the evening every day of the week, so we're going to put 8 mg or 1 5 mg capsule and 3 1 mg capsule in the Sunday morning box. Envarsus comes in 1 mg tablets and 4 mg tablets. For example, if you're on 5 mg of Envarsus daily, then you'll need 1 4 mg tablet and 1 1 mg tablet. We recommend going across the box the long way, so we're going to put the same amount in the Monday morning space and fill that across the rest of the morning slots for the rest of the week. If you have different doses of tacrolimus during the day, for example 8 mg in the morning and 7 mg in the evening, make sure you're putting the right dose in the right time slot.
It is important that you take the correct dose of tacrolimus because we look at your tacrolimus levels in your blood to decide if you're getting the correct amount of immunosuppression. Make sure on lab days you wait until after your blood is drawn to take your morning dose.
Next, we'll be filling our mycophenolate or Myfortic. In our folder, the dose of mycophenolate is 720 mg twice daily, so we'll want to grab our 360 mg bottle. To reach our dose of 720, we'll be using 2 360 tablets. Our folder says we will take this in the morning and in the evening every day of the week. Like we did with the tacrolimus, we'll fill across the box the long way, putting 2 tablets in the morning space and 2 tablets in the evening space for each day. If you're taking Myfortic 4 times a day, then you'd want to place 1 tablet into each time slot of the day.
It looks like we only have a few tablets left in this bottle. When you notice that your bottle is running low on medication, call your pharmacy. If you're using the University of Maryland, use the number on your Pillbox to request refills of your medications. It is important that you request refills at least 5 to 7 days before you're out of medications.
Now, we will refer to our prednisone dosing sheet to correctly fill this medication. The prednisone dose will be referring to the sheet with the dates listed. When filling out prednisone, make sure you're putting the right amount in each day, since the dose will be decreasing every 2 to 3 days. Some days, you might have to cut the tablets in half in order to get the correct dose. To do this, you can use the pill cutter that you get on discharge.
Moving on to infection prevention medications such as Valcite, or the generic name valganciclovir, or Bactrim, also known as sulfamethoxazole trimethoprim. We're going to be looking at the folder to see how often we'll be taking it. Most people will be on these medications once daily, but some may be on it less frequently, such as every other day, depending on their kidney function. This is how you correctly fill the pill box.
Our folder says we're taking Valcite, or valganciclovir, Monday, Wednesday, Friday, so we're only going to fill it for Monday, Wednesday, and Friday.
When filling these medications out, double check which days you are taking it.
Only medications that are scheduled should go into your pill box. Medications that are taken as needed, such as Colace, also known as Docusade, or pain medications, will not be put in the pill box. We will keep the prescription vials and take them only if we are having symptoms.
Today we have reviewed how to fill your pill box at home. Each week you will fill your pill box and bring with you to TCC until you're more comfortable with the process.
Your anti-rejection dosing and schedule may change during your TCC visit depending on lab values, so it's important to understand how to fill your pill box.
We hope that this video has helped you understand how to better manage your medications.
As always, if you have any questions, concerns, or problems filling your pill box, please do not hesitate to reach out to your coordinator and the transplant team.
Thank you for watching.